Hey, lunchtime lifters, heavy lifting. How are you? Hopefully, your weekend was good. Weather was so here, but it's actually a clear day today. Hope you did something fun with somebody, reached out to them. I have a couple shout outs. Shout out to nice. I like everybody checking in. Makes me feel loved. I feel so. I'm kvelling. Anyway, shout out to my mother, who she lives in the villages in Florida, and at 80 something years old, she organized the whole Zoom get together with my whole family. So shout out to my mother. It was good to see my nieces and nephews. Shout out to Ezra, Eli, and Stella, and Rachel. So that was nice, and it was a nice little family get together. So thanks, Mom. Um, the usual stuff with us. I planted 2 bushes and a tree I ordered. I planted a cherry tree. I was like Ronnie Appleseed, but it wasn't an apple. It was Ronnie cherry seed or something like that. It was a cherry blossom tree I ordered. I was so excited for it to come, but it was like a stick. So we'll see what happens. You can touch base with me in another 5 years, and I'll send you a picture. Anyway, we had, I thought today, because there was actually an accident over the weekend. I'll get into it. Nobody's badly hurt or anything like that. Everything's okay. But it made me think of, how can you take care of yourself at home if you get injured? So this is what happened. It actually, unfortunately, was with my favorite granddog, Nike. And when he was playing, he gets a little rough at times, and so he bit the ear off of his bunny. So unfortunately, the bunny only has one ear. We were able, basically, he avulsed the ear from the bunny, and we were all very concerned about the bunny. So Nike was okay, no blood. He felt horrible. He wanted to keep actually playing with the bunny, but we had to remove the bunny from the scene because it was not a good situation. So I thought I would take the opportunity to show you what we do. And actually, I had a good friend who injured his hand. Shout out to Scott, making freaking French fries, sliced his hand with the French fry slicer, potato slicer. So if you're stuck at home and injure yourself or have a bunny that gets injured, I thought I'd show you, what we do. And like, you should call me in the office. We get you in. So I don't want you to go into the emergency room, right? So I just thought I would have a demonstration, right? What great time for a demonstration. So anyway, poor bunny, what we would do is we would have what I am going to do. I'm going to show you how to do this, and I think, are you okay with it? Yeah, he says okay. So he's going to lay down on the table, right? And basically what's going to happen is, of course, we clean the area well, and then of course, everything has to be sterile. So we want to put on our sterile gloves. Now at home, if you're not doing it, just wash your hands really well, okay? Just wash your hands really well, soap and water. Soap and water for the wound is fine. If you don't have to worry about a special antiseptic. You want to clean the area. You want to try and get, if the injury is at home on gravel or dirt, it may sting a little teeny bit, but you want to make sure you clean. So put on your gloves. And then what we would do is, what we're going to do today is we are going to anesthetize the area so it doesn't hurt, right? We don't want it to hurt bunny. So we're going to anesthetize it, and I like to use lidocaine, and this is a special medication, sodium bicarbonate. It takes the sting out of the local anesthetic. So, you feel like a little needle stick, but the medicine itself doesn't hurt. So we're going to draw that up right? We're going to take that up. We're going to draw it up and use a combination of both. You don't really have to worry about it. If you don't have any anesthetic at home, like a shot of bourbon, a little vodka, it'll work. It'll be okay. You can use a bullet if you want to. They did that. So now we've washed the area well, and now, Bunny, you're gonna feel like a little teeny needle stick, and then that's it. Okay, wait a minute. Little needle stick. 1, 2, 3. Okay, take a deep breath. Deep breath. Easy, easy. This is gonna be the worst it gets. Easy, 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 easy. You're doing great, doing great, doing great. Okay, now we're gonna let that work for about 5 minutes or so while I get the rest of my instruments and tools ready. So we're gonna use a special kind of a suture. This is called, it's like a nylon, and it's on a straight needle. So sometimes I will use actually instruments with a clamp or a needle holder and pickups, but you're probably not gonna have that at home. So you could just get like a needle and thread, and this is what I'm going to show you today. So we're going to take that out, and this just comes out. It's all sterile, so it comes out. And now, fortunately, we have the piece, right? So if you cut something off your body, save it, put it in some water, or wrap it in a gauze, and so that you can bring it to the office, because I might be able to sew it back on. So I thanks everybody for joining in, and so this is, it doesn't hurt. It's been anesthetized, and we're just gonna sort of start sewing this ear back on. So we're going to do this, right? Put that first stitch in. It's always good to have some like emergency equipment at home, just in case you need it. All right. So that's that first throw. We want to get it attached. Then of course you want to cut off that extra suture. And now we want to just follow ourselves along, right? So we want to follow ourselves along with this. And we want to try to get it attached just to the same area that the ear was on before, because typically your ears are in a particular area of your head, and if they're not there, then you're going to look a little funny. So as you can see, I'm getting this front end together. Now, in real life, we actually do operations on the ear. It's called otoplasty. Oto for ear, plasty for fixer-upper. So sometimes for children who have protruding ears, they have those Dumbo ears, they get teased. So this is actually a very good operation. It's a very safe operation. Typically do it at around age 7 to 9. So here we see we have the front part, or the bottom part of the ear, and now we're going to just come right around and get the top part of that ear going. As you can see, it doesn't take too long, and Bunny's feeling okay. He's not hurting. It's anesthetized. It's okay. Fortunately, there's not really that much blood today. If it does start bleeding, this is another little trick. If you hurt yourself at home and it starts bleeding a little bit, just put pressure on it. Don't peek. Elevate the area. Keep pressure on there, and it'll stop. It will stop. All right, so the ear is now on, and we're gonna just tie that knot back. So that'll work. We want to cut the extra threads off. There we go. And now our bunny has 2 ears just the way he's supposed to. Okay? And now Nike is going to be very happy. But now, after you put that on, you need to put a little bacitracin, neosporin, triple antibiotic, whatever you got. You put it on there, and then you put a little bandage on there, right? You want to bandage it up. You want to keep it dry. Let's see. All right. So you don't want to cover the face completely, but there you go. So it's all fixed up, right? Take this off in a week. It's like baking a pie, baking a cake. You take it off in a week. It's all healed up. Might not even be any stitches to remove, and that's it. So that's what I got to say today. You know, how to fix yourself up at home. Nike's going to be thrilled, and have yourself a safe day.